So my name's Nicole, and I did my practicum with Island Sexual Health Society and their proposed program, Generation Gyrl. I would like to start with a territorial acknowledgement for the Songhees, Esquimalt, and Wasanich people from the Coast Salish Nation on the lands that we're presenting today. So Island Sexual Health is a nonprofit organization that services Victoria, the Vancouver Island, and the Gulf Island regions. They provide sexual health resources in the form of confidential clinical services, educational services, and a host of online resources. They use these to support their vision of supporting a community that celebrates diversity and healthy sexuality throughout life. So as a practicum student, my roles were quite varied. I spent time volunteering at their Quadra Street clinic, shadowing birth control education sessions, shadowing community educators, planning and hosting community events such as Sexual and Reproductive Health Awareness Week. And all of these kind of tied into my individual practicum project of Generation Gyrl. So Generation Gyrl is a program Island Sexual Health has proposed for the future for female identifying youth in the community. They hope to use this program to educate them on topics of not only sexual and reproductive health, but self-esteem, body image, healthy relationships, community, and identity. As a practicum student, I had two main roles. The first was to find activities and resources that could be used to support the workshop themes. And the second, which was a lot of fun for me, was to test out a Generation Gyrl workshop. So I called my workshop Girls Night, which was a condensed version of a Generation Gyrl workshop that I hosted for my colleagues on the University of Victoria women's golf team. We went through a workshop and then asked them to anonymously reflect on the layout of the workshop and the themes that we introduced. We thought it was really important to ask them what they thought was important to introduce to a younger generation of girls. We got a lot of great feedback. It was a really good formative evaluation process for us, and I'm gonna call it a great success. So during my time at Island Sexual Health, the BA program's value, skills, and knowledge areas that we learned about had a great impact on my practicum. Though there's many, and I've only listed a few here if you can imagine it, there was two that I would say had the greatest impact on my time: the knowledge area of improving health and reducing health inequities in communities, and the skill of facilitating health literacy. So this practicum placement for me was my first real exposure to community and health services. It was my time to understand what my community has to offer and what Island Sexual Health has to offer the community. From this, I gained an understanding that community health can be improved by targeting a subsection, in this case, the female identifying youth community in Victoria, by offering them the resources to not only support their well-being, but the safe space to promote conversation. This really tied into health literacy. For myself, I learned a great deal about health literacy, the means to communicate information effectively and accurately for the audience you're trying to target. If you see up on the board, we use this bingo icebreaker in my test session as not only a way to acquaint the girls with one another, but to actually acquaint them on some of the topics that we talked about. The test session proved not only to be a great reflection for the proposed program, Generation Gyrl, but also proved to be a great way to promote health literacy within my own peers. So when I piece it all together, my practicum experience was kind of like a puzzle. All of my learning experiences fit together really well with one another and supported each other. When I reflect back on my coursework working into my practicum placement, it gave me a great basis to go from a student to a professional fairly seamlessly for a mere semester. And as much as I'm sad to be leaving this experience, it was really amazing. So as I tie it up and let you guys all leave and go home and relax, I would like to thank all my professors and my colleagues and my advisors, and of course, Island Sexual Health Society for giving me the opportunity to learn about health and community services in such a supportive environment. Thank you.
Thank you so much, Nicole. Were there any questions? Oh, good.
I can probably just yell it.
No, I need the exercise.
It's really not a big question. I'm just curious about your choice of doing a Y instead of an I for the girl.
So when I came to Island Sexual Health, they had already started the proposal for the program, and Generation Girl is the name that they came up with. So I actually asked the same question, because like you guys, I probably thought it was a typo. It wasn't. The idea to use the Y instead of the I had kind of a dual meaning. The first was the group is supposed to be for anyone who may feel they identify as female, and using the traditional spelling of girl may exclude those who don't feel like they fit into that traditional category. Also, the use of why prompts us to ask questions and why are we learning about these things, why are they important? So kind of two meanings there.
Good, well, thank you. Oh, so, one more question. Good. You realize you're cutting into Kathy's time?
I have some experience doing like sexual health education to a variety of groups of people as well, and I was just wondering if Generation Girl is successful, how will you kind of spread it out into Victoria? Like, is it a volunteer thing, or will you go into schools, or just wondering what that plan is?
So Island Sexual Health has a lot of great partners. In schools already, they do a lot of the sexual health education here on the island. Right now, I'm not sure what the rollout plan for it was. I believe it was supposed to be like a workshop series once a week for a couple hours, maybe after school, so a school setting would be a great way to get in and get the program rolling, but it could also be run through a bunch of different community groups and with different community partners, which is things that they are considering. Yeah, and they do have other programs like Man-Made, which is what prompted the addition of this program that targets the male-identifying youth community around themes of masculinity. So they already kind of have an in on program implementation.
Excellent. Well, thank you very much again.